Adjacent segment disease, or ASD, is a significant complication that can arise after spinal fusion surgery. This condition involves the degeneration of spinal segments next to the fused area, leading to symptoms such as pain, neurological issues, and sometimes the need for further surgeries. As spinal fusion procedures become more common worldwide, understanding ASD is increasingly important for both patients and healthcare providers. In this video, we'll explore what ASD is, why it happens, and how it impacts those who have undergone cervical or lumbar spinal fusion. We'll also look at the latest research on risk factors and treatment strategies, aiming to provide a comprehensive overview for anyone interested in spinal health. Spinal fusion is a surgical procedure where two or more vertebrae are joined together to eliminate movement between them. This is typically done to provide stability and relieve pain caused by conditions like degenerative disc disease, scoliosis, or spinal instability. Surgeons use bone grafts and hardware such as screws, rods, or plates to help the bones fuse. While spinal fusion can be highly effective for certain conditions, it also changes the biomechanics of the spine, which can lead to increased stress on the segments adjacent to the fused area. This shift in mechanical load is a key reason why ASD can develop after surgery. Adjacent segment disease refers to the degeneration of spinal segments next to a previously fused area. This can manifest as disc herniation, spinal stenosis, or facet joint arthritis. Patients may experience chronic back or neck pain, nerve compression, or even neurological deficits. The risk of ASD increases as more spinal segments are fused, and the condition can develop years after the initial surgery. Understanding the mechanisms behind ASD is crucial for developing strategies to prevent and manage this complication. Epidemiological studies show that ASD can occur in 2% to 36% of patients after spinal fusion, depending on the spinal region, surgical technique, and follow-up duration. In the United States alone, over 500,000 spinal fusion surgeries are performed annually, making ASD a significant concern. Clinically, ASD may present as chronic pain, radiculopathy, or myelopathy, especially if nerve compression or spinal canal narrowing occurs. Early detection and intervention are key to improving patient outcomes and reducing the need for additional surgeries. Age is a well-recognized risk factor for ASD, but research findings are mixed. Some studies suggest younger patients, especially those under 40, are more likely to require additional surgery for ASD after cervical fusion. Others highlight advanced age as a risk factor, particularly in lumbar fusion cases. The overall reoperation rate due to ASD is highest in individuals aged 30-39 and decreases with age. These variations may be linked to differences in physical activity and underlying health conditions, indicating that age alone does not fully explain ASD risk. Body mass index (BMI) is another important factor. Obesity can overload intervertebral discs and accelerate degeneration, increasing the risk of ASD. Some studies have found that a BMI over 34 is associated with higher ASD risk after lumbar fusion. However, other research has found no clear correlation, especially in cervical fusion cases. Maintaining a healthy BMI before and after surgery is generally recommended, but more research is needed to clarify the relationship between BMI and ASD development. Low bone mineral density, BMD, and osteoporosis can reduce vertebral strength and alter stress distribution in the spine. After fusion surgery, BMD in adjacent segments often decreases, which may contribute to ASD. Studies show a higher prevalence of ASD in postmenopausal women and those with osteoporosis. However, some research suggests no direct association, highlighting the need for careful monitoring and timely anti-osteoporosis treatments in a at-risk patient. Diabetes can alter the composition and biomechanics of intervertebral discs, increasing the risk of degeneration and instability. Diabetic patients undergoing multilevel fusion may face higher complication rates, including non-union and pseudoarthrosis. While some studies show diabetes as a risk factor for ASD, especially after lumbar fusion, others find no significant effect in cervical cases. More research is needed to understand the impact of diabetes control on ASD risk. Patients with pre-existing spinal degeneration, such as disc degeneration, facet joint arthritis, or vertebral slippage, are at higher risk for developing ASD after fusion. These conditions reduce disc height and alter biomechanics, increasing pressure on neighboring segments. MRI findings of degeneration before surgery are strong predictors of ASD. Addressing these issues preoperatively can help reduce the risk of postoperative complications. Proper alignment of the spine and pelvis is crucial for balanced load distribution. Imbalances in parameters like pelvic incidence, pelvic tilt, sacral slope, and lumbar lordosis can disrupt this balance, leading to abnormal forces on adjacent segments and accelerating degeneration. Studies show that postoperative mismatch in these parameters significantly increases ASD risk. Surgeons must carefully consider spinopelvic alignment during planning and surgery. Length of the fusion construct is a critical surgical factor. Longer fusions restrict spinal mobility and increase mechanical load on unfused segments, promoting degeneration. Studies show higher ASD rates with longer constructs, especially near the thoracolumbar junction. Careful preoperative planning is needed to balance the benefits of stability with the risk of adjacent segment overload. Choice of surgical approach and the extent of tissue disruption during surgery can influence ASD risk. Techniques that cause more damage to muscles, ligaments, and facet joints increase stress on adjacent segments. Minimally invasive surgeries, which preserve more tissue, are associated with lower ASD rates. Preserving the superior facet joint capsule and minimizing muscle dissection are important strategies to reduce postoperative complications. Firm fixation methods, such as rigid versus dynamic systems, can affect the development of ASD. Rigid instrumentation may lead to earlier onset of ASD, while dynamic stabilization systems help preserve motion and reduce stress on adjacent segments. Hybrid systems that combine dynamic and static components show promise in maintaining spinal stability and reducing degeneration. The choice of fixation should be tailored to each patient's need. Emerging research suggests that genetic predisposition and inflammatory mediators play roles in ASD development. Certain gene variants are linked to disc degeneration, and elevated levels of inflammatory cytokines like TNF-alpha and are found in degenerative disc disease. These biological factors may influence how patients respond to spinal fusion and their risk of developing ASD. Understanding these mechanisms could lead to targeted prevention strategies in the future. Lifestyle factors such as smoking and alcohol use can negatively impact spinal health and increase the risk of ASD. Smoking reduces blood flow and impairs healing, while alcohol can lower bone density and hinder regeneration. Patient education, compliance with rehabilitation, and psychological health also play important roles in recovery and long-term outcomes. Addressing these factors is essential for comprehensive ASD management. Diagnosing ASD involves a combination of clinical evaluation, patient history, and imaging studies. Symptoms such as pain and neurological deficits are assessed, while MRI and CT scans help detect degenerative changes in adjacent segments. Early and accurate diagnosis is vital for effective management and can help guide treatment decisions, whether conservative or surgical. Many patients, conservative treatments are the first line of defense against ASD symptoms. These include physical therapy, rehabilitation medications such as NSAIDs and muscle relaxants, and lifestyle modifications. Postoperative rehabilitation focuses on strengthening spinal muscles and restoring core balance, which helps distribute mechanical loads and reduce stress on adjacent segments. Early intervention and a tailored rehabilitation plan can significantly improve function and quality of life. When conservative measures are insufficient, interventional treatments such as epidural steroid injections and facet joint interventions can provide pain relief. These procedures target inflammation and nerve irritation, offering temporary or sometimes longer-lasting relief. Radiofrequency ablation is another minimally invasive option that targets pain-transmitting nerves in degenerated facet joints. These interventions can be valuable tools in managing ASD, especially for patients not ready for surgery. Surgical intervention is considered when conservative and interventional treatments fail, or when there is significant spinal instability or neurological deficit. Options include total disc replacement, extension of fusion, decompression surgery, and minimally invasive techniques. Each approach has its own risks and benefits, and the choice depends on the patient's specific pathology and overall health. Advances in surgical technology continue to improve outcomes and reduce complications. Innovative treatments are on the horizon for ASD, including stem cell and exosome therapies, growth factor injections, tissue engineering, and advanced biomaterials like 3D printed cages. These approaches aim to promote regeneration and repair of intervertebral discs, potentially reducing the need for revision surgeries. While most are still in experimental stages, ongoing research is promising and may revolutionize ASD management in the future. ASD remains a challenging complication of spinal fusion surgery, influenced by a complex interplay of mechanical, biological, and lifestyle factors. A multidisciplinary approach that includes careful patient selection, advanced surgical techniques, comprehensive rehabilitation, and emerging therapies is essential for optimizing outcomes. Ongoing research and innovation hold promise for reducing ASD incidence and improving quality of life for patients worldwide. Staying informed and proactive is key to managing this evolving aspect of spinal health.